The Central Coast has been included in the latest Greater Sydney lockdown from the get-go. However, calls for a mass vaccination hub to be set up in the region seems to have fallen on deaf ears.
If we've seen a mass vaccination centre set up in Belmont for the Hunter New England while they're not in lockdown, we're seeing a centre that's going to be online in Wollongong soon. There's now 3 in Sydney. A community like ours, with a population where 1 in 5 people are aged over 65, where we've got close to 350,000 people, we need to be a priority. I mean, we've had active cases on the Central Coast. We've had a growing number of exposure sites. There was fragments in sewerage only last week. There was a healthcare worker at Gosford Hospital last week who was an active case. So our community is at risk.
Federal Labor member for Dobell Emma McBride questions the state government's view of the Central Coast.
And people have said to me that it appears that they kind of consider us part of Greater Sydney when it's convenient to them, and they rule us out of Greater Sydney when it's not. And that could be grant funding. That could be in terms of vaccines. So I mean, we are recognised as a standalone region. What we don't see is the government treating us like one.
However, instead, over the weekend, some Central Coast residents had their PFIZER vaccine appointments cancelled, with the state government's doses redirected to Sydney to vaccinate Year 12 students.
I had a mum contact me. She's 45, she's a sole parent, and her oncologist says that she needs PFIZER. She can't get a booking anywhere. And he said to her the earliest that she was able to find was the 15th of September. And he said by then, her immune system might not cope and she might not be able to have the jab. I've had teachers contact me who had appointments cancelled over the weekend, who teach Year 12 students in Western Sydney where the jabs are being redirected to, whose appointments were cancelled. It just doesn't make sense that in a community like ours that is at risk and in lockdown, where people in 1A and 1B, whether they're older people or people with disability, haven't had a vaccination, that our vaccinations are being sent elsewhere.
Central Coast News questioned Minister Brad Hazzard about the vaccine redirection from our region. However, his office's response was slightly off topic. Parliamentary Secretary for the Central Coast, Adam Crouch, has said in a statement that we would not be in this Hunger Games situation if the federal government had given us enough doses.
Prime Minister and the government at a federal level didn't secure enough deals on vaccines at the very beginning.
However, federal Liberal member for Robertson Lucy Wicks says that's not the case.
What's happened over the last couple of weeks is that the federal government has provided the New South Wales government with an additional 200,000 doses of PFIZER, including 50,000 additional doses in the last week alone.
And says it comes from higher up the supply chain.
The federal government purchased 40 million supplies of the PFIZER vaccine on top of more than 50 million supplies of AstraZeneca vaccine. But the issue with the PFIZER, unlike AstraZeneca, where supply is plentiful and we also are able to produce it here locally in Australia, the issue with the PFIZER vaccine is actually one of limited global supply around the world. And a decision was taken globally to prioritise other countries that had a mass death rate. A death rate far, far higher, multiple times higher than what we in Australia experience.
The federal government's vaccine rollout, however, will increase in coming months.
And so while we were receiving around 300,000 doses a week in May and June of this year, recently that doubled to 600,000, and in the last couple of weeks and onwards, we will be receiving 3 times that amount, at least 1 million doses a week, and that will increase. So the bottleneck that we are feeling in relation to access to the PFIZER vaccine is going to ease in the coming weeks as more supply comes in from the limited global supply, more supply comes in to Australia.
Ms Wicks has confirmed the region's federal PFIZER supply is still available.
Doses are also distributed through the federal channels, including GP-led clinics, the Erin Respiratory Clinic, for example, and of course in coming weeks there'll also be the community pharmacies as well. When I heard about the cancellation of some of the PFIZER appointments at Gosford, at Wyong Hospital, at Belmont Mass Vaccination Clinic, I rang the Federal Minister for Health and spoke directly to him. I received very firm assurances that the GP-led clinics here on the Central Coast, the 12 GP-led clinics and the Erin Respiratory Centre, the Erin Respiratory Clinic have no change. Those vaccines, those PFIZER vaccines have not been redirected. They will not be redirected to Greater Sydney. And in fact, The federal government had refused a request from the state government to redirect those to Greater Sydney.
It comes as new data released today from the Australian Immunisation Register that says 45% of coasties over the age of 15 have received their first vaccinations. Skaie, Central Coast News.